Hey everybody, Dr. Seth with the Cafe of Life Chiropractic Center. Hope you guys are doing well. This month in February, we have been talking about spinal discs and all things related to spinal discs. I've been in practice for the last 26 years, almost 26 years, and we see a lot of patients with disc issues. Whether lower back discs, discs in the neck, occasionally discs in the thoracic spine, but for the most part, a lot of low back discs and a lot of neck issues as it relates to the discs as well. So I think the question is for so many people, so I have a disc, I have a herniated disc, I have a bulging disc, I have sciatic pain, I have radiating arm pain. What can I do? I don't want to take anti-inflammatories, I don't want to do cortisone injections, but I've got I'm just struggling. Can you help me? And, the first thing we want to try to do when patients come in is get an accurate understanding about what's going on. Oftentimes people think they have a disc issue and they don't have a disc issue. So we want to accurately diagnose and find out what's going on. Consultation, trying to find a good understanding about what your health history is, what's been going on. Diagnostics, we do x-rays in the office. Sometimes MRIs are appropriate. Oftentimes we don't need the MRIs, but we do physical examination. There's lots of orthopedic tests, neurological tests. So between consultation, physical examination, orthopedic neurological evaluations, x-rays, we can gather a lot of good information, and then kind of taking a look at the symptomatology and how things are going, how you're presenting to the office, we can get a good understanding about what's going on for you. And then we can determine what's the best course of action as it relates to helping you with your disc issues. So is it just straight up compression? Do you have degenerative arthritis and the spine is compressed and it's putting pressure on that disc? Is the disc a bulging disc? Is it a protruded disc? Is it a herniated disc? Is it an extruded disc? There's all different types of disc issues that you can have. But first things first, it's like we want to try to help people get out of pain as quickly as possible. Do we want to work towards restoration? Do we want to look towards rehabilitation? Do we want to get people back on track and help them to just get ahead of the situation that they have? Of course. But first things first. First goal is always to help people feel better as quickly as possible. And we want to get them functioning better. So usually it's really about, hey, what's going on? Oh, well, I can't sit. Well, first things first, let's get you out of pain so that you can start to sit. Then we can talk about what do we need to do to rehab this situation and get you back to where you need to be. I've worked with many different patients over the course of, my almost 26 years in practice. And we start with a combination of a variety of different techniques depending upon how you're presenting to the office. Some people need to be helped in with their arm around somebody because they can barely walk. Some people are just, I've got some sciatic pain, it's intermittent, it's really impacting my ability to play tennis, golf, etc. Depending upon how acute you are when you come in the office, we're going to start off with some conservative care. That could be traditional chiropractic care. There's different techniques in chiropractic. When people think about chiropractic, they think about popping and clicking and, kickstarting you like a Harley and all those different types of techniques. And yeah, I do traditional manual adjusting. We do popping and clicking and all of that. But we see a lot of people with other different types of techniques. We use drop table technique. We use instruments that are low force techniques that don't have any popping and clicking. And so there's lots of different techniques, right? So we use traditional chiropractic, drop table, instrument adjusting. But chiropractic is very important because the reason that you want to have chiropractic is because chiropractic is the only profession that works towards correcting what we call subluxation. Now, subluxation is a fancy term, but subluxation basically just means misalignment of a vertebrae that puts pressure on the nerve, and that pressure on the nerve will cause interference and will cause lack of function. And so as chiropractors, our major goal is to help communication between the brain and the body and the body and the brain, right? We know that the nervous system is the master communication system that coordinates everything. Every cell, tissue, and organ of your whole entire body is controlled and regulated by the nervous system. Just so happens that that nervous system is encapsulated within your skull, within your brain, but then it comes down into your brain stem, comes down into your spinal cord, and then it comes out at every level of your spine. And again, it controls every cell, tissue, organ, and system of your whole entire body. Primarily, we want to make sure to adjust the spine so we can, enhance the signaling between your brain and your body and your body and your brain so that you can actually start to heal. Not only that, but increasing mobility into the joint will help the tissues heal. When you have compression, when you have disc injuries, you have damaged tissue. That tissue is generally inflamed, it's generally irritated. So when we adjust the spine, whether it's through traditional manual adjustments, low force instrument adjusting, or whatever. The idea is that we're signaling receptors in the joint that help the body start to heal. So first and foremost, we're going to be doing some chiropractic. And there's all different ways to do chiropractic. So we have a variety of different techniques. There's no one technique that's right for everybody. But depending upon what's clinically necessary to accomplish the results that we're looking for and your comfort level, there are all different kinds of techniques that we can utilize. We also use what we call non-surgical spinal decompression in the office. So we have a non-surgical spinal decompression table. Those tables are a sophisticated form of traction, right? So we are lengthening, elongating, and tractioning out the spine to axial distract, lengthen, and elongate. When we do that through spinal decompression, the goal is that we are trying to create more room for the nerve and through the spinal cord. The idea is, and studies have been done, is that you can basically create a negative pressure in the disc. So your spinal discs are connected to the vertebrae, right? So let's say a lumbar vertebrae. So let's say we're L4, L5 vertebrae. In between the L4 and L5, we have a disc. That disc is attached to the vertebrae. When we lengthen and elongate and stretch those vertebrae, they are attached to the disc. And the idea is that if the pressure in those discs is generally 75 millimeters of mercury, when we get you on the table, we can get to, call it negative 150 millimeters of mercury. That creates a negative space and a vacuum that draws oxygen, nutrients, and minerals back into the disc and allows toxins to get outside of the disc. Now, does that happen every time? Does it always get to negative 150? No. Does it happen every time? No. However, what we find is that when we lengthen and elongate and we stretch in a sophisticated form of axial distraction or traction, patients get relief regardless of whether we're creating a negative space. There have been MRI studies, pre and post MRIs, to show that you can increase the height of the disc minimally, but that doesn't necessarily mean that it happens in everybody. Nonetheless, the large majority of patients that have disc injuries or disc problems that get on the decompression machine oftentimes find relief when we lengthen and elongate the spine in conjunction with safe and conservative chiropractic. Now, we generally add manual therapy or massage therapy or deep tissue body work into our protocols as well. So when we get in and we work the surrounding musculature, if that's the low back, we're talking hip flexors, psoas, iliacus, hamstrings, butt, glute, piriformis, QLs, you name it. When we're working all of these muscles to release pressure and to reduce muscle contraction and release that also helps to unload the spine as well. If we're using chiropractic to increase the signaling and help the body start to heal and send the right signaling, and we're using spinal decompression to lengthen and elongate, stretch the spine, perhaps maybe creating a negative pressure in the disc, maybe, oftentimes yes, doesn't matter. Oftentimes patients are getting really good results with lengthening, elongating, and distracting the spine. Ever heard of an inversion table? People come in, I have an inversion table, or I've been on an inversion table. The concept is similar. Unload the spine. We're just doing it safely, conservatively, and more effectively than your traditional inversion table. And then when we add the deep tissue therapy in there, that helps to unload the myofascial, or the muscle and the fascia, which is this web of tissue that is causing compression in through there as well. The next phase is also, rehabilitation. What are we going to do to strengthen and stretch? Got to be careful here. Can't put the cart before the horse. But we like to start getting our patients doing rehabilitative exercises as quickly as possible. We give a uniquely designed exercise program to each patient that is web-based, that is in a HIPAA-compliant portal that will send you a prescription for exercises. Start doing the basics, right? Not to overdo it. And then we have to talk about lifestyle, because it is our lifestyle that most likely, unless you had an injury where you try to pick up a sofa by yourself and you popped a disc, most of the time it's lifestyle. Most of the time it's repetitive stress. Most of the time it's chronic degenerative arthritis over time. But we need to talk about your lifestyle, what you're doing and what you're not doing. Oftentimes patients are doing things throughout the course of their day that are consistently re-exacerbating a problem. Many people come into my office with chronic conditions that are acutely exacerbated. So if you have a chronic low back issue that's tight, it's kind of irritated, it's annoying, but it's usually manageable. Then over time, that tension builds and builds and builds, and all of a sudden it becomes acute. Maybe you bent over and picked up something insignificant, and all of a sudden, whoa, it's out. And then when that gets out, then you have an acute exacerbation of a chronic condition. But it will stay acute because of the things that you're doing day in and day out that keep it acute. In any event, that's just kind of a little brief kind of interlude into what it is that we do in the office to help people with spinal disc injuries. We've seen them a lot. We know what to do. We know what not to do. We work with a variety of different doctors in the Bay Area. We know most of them, and so we're often on a really good referral basis with anybody that needs to be referred. So one thing that we really need to do, one thing that we really know how to do, is to stay in our lane. If there's something that's kind of outside the scope of what we do, then we work with orthopedic surgeons, we work with pain management specialists, we work with physical therapists, we work with primary care docs to kind of have a collaborative effort to help you get the results that you're looking for, right? Because I don't need to be the hero. I like being the hero, but I don't need to be the hero. If we're doing something and we're conservatively treating and you're not getting results, then we're going to either change our technique or we're going to refer you to somebody that can help. And we know most of the people in the area that can help. We have a really good relationship with other practitioners in the Bay Area to get you the care that you need. Hopefully this has been just kind of a good just description about what we're doing to help patients with disc injuries. And we're going to be doing a lot more education about the disc itself, how it gets injured, what you can do to prevent injury, and a little bit more about what it is that we do to kind of help patients with disc injuries in the office and outside the office as well. And if you're looking for more of that information, you can join us for our seminar at the end of the month. Details are, around, and we'll get those details to you. Call, text, email the office, or there's probably a link below. All right, have a good one, and we look forward to seeing you soon. Thanks.